Hello, I'm Wamala and you're watching Hornbilltv English News Bulletin. First news in headlines. The Union Health Ministry on Friday wrote a letter to all states and union territories, asking them to undertake a detailed review to ensure that prompt and necessary steps are taken for the safety and well-being of healthcare workers, besides a strict implementation of the amended Epidemic Diseases Act. India is prepared with more than sufficient availability of amphotericin B and other drugs required to treat Mucormycosis, commonly known as black fungus, said Union Minister Mansukh Mandavia on Friday. He informed that as of June 16, there are about 27,142 Mucormycosis cases in the country. The Indian SARS-CoV-2 Consortium on Genomics of INSACOG, a consortium of 4 city clusters, Bengaluru, Hyderabad, New Delhi and Pune, will soon release a report on Delta Plus variant, government sources informed on Friday. Now, news in details. India is prepared with more than sufficient availability of amphotericin B and other drugs required to treat Mucormycosis, commonly known as black fungus, said Union Minister Mansukh Mandavia on Friday. He informed that as of June 16, there are about 27,142 Mucormycosis cases in the country.
If cases increase, India is prepared with more than sufficient availability of amphotericin B and other drugs. Domestic production has also increased over 5-fold, he said, adding in April, just about 62,000 vials were being produced and now it is expected to cross 3.75 lakh. While increasing domestic production of the drug, India also placed orders to import 9,05,000 liposomal amphotericin B vials, he added. He added that the Chemicals and Fertilizers Ministry has allocated a total 7,28,045 vials of liposomal amphotericin B to all states and central institutions till June 17. Mucormycosis or black fungus is a complication caused by a fungal infection. People catch mucormycosis by coming in contact with the fungal spores in the environment. It can also develop on the skin after the fungus enters the skin through a cut, scrap, burn or other types of skin trauma, as per the Union Health Ministry. The disease is being detected among patients who are recovering or have recovered from COVID-19. Moreover, anyone who is diabetic and whose immune system is not functioning well needs to be on the guard against this. Several states including Madhya Pradesh, Rajasthan, Bihar, Gujarat, Punjab, Haryana, Karnataka, Odisha, Telangana and Tamil Nadu have declared it a notifiable disease under the Epidemic Diseases Act, thereby making it mandatory to report every mucormycosis case to the state government.
The Union Health Ministry on Friday wrote a letter to all states and union territories, asking them to undertake a detailed review to ensure that prompt and necessary steps are taken for the safety and well-being of healthcare workers, besides a strict implementation of the amended Epidemic Diseases Act.
It is requested that all states may undertake a detailed review and ensure that prompt and necessary steps are taken for healthcare workers' safety and well-being, besides a strict implementation of the amended Epidemic Disease Act. Love Agarwal, Joint Secretary of the Union Health Ministry, wrote to states and UTs, condemning the incidences of physical violence against doctors and other professionals or healthcare workers, particularly from Assam, West Bengal and Karnataka. He said that such incidents impact the morale of our healthcare workforce, who have shown exemplary commitment against all odds in COVID-19 management. The endeavours to manage COVID-19 so far are replete with examples of commitment shown by healthcare workers at all levels, the letter stated. While the country at large has applauded the efforts done by the health fraternity, there also have been examples where they have stigmatized and even violence is resorted to against the HCWs, the letter said. The Centre has taken a number of initiatives for ensuring safety and security of healthcare workers, he said. On April 22, Union Ministry of Health issued an ordinance duly amending the Epidemic Diseases Act 1897, providing protection to healthcare personnel and their property against violence during epidemics.
The National Human Rights Commission (NHRC) has directed the Union Ministry of Health and Family Welfare to treat teachers who are engaged in COVID duties as frontline corona warriors in all the states and UTs at par with other employees. The ministry has also been directed to ensure that they get insurance and compensation equally at the earliest, and to release the amount of compensation and other service benefits to the deceased teachers at the earliest. Acting on a petition filed by seasoned human rights activist and lawyer from Supreme Court on Civil Rights, Radhakanta Tripathi, the NHRC passed the order. Citing certain examples across India, Tripathi contended that the next of kin of Simanchal Satpathy, a deceased teacher from Ganjam district of Odisha who died in the line of duty on 3rd July 2020, has not been paid any amount even after 10 months of his death. According to Tripathi's petition, his parents committed suicide after coming to know of Simanchal Satpathy's death. Raj Kishore Satpathy and his wife Sulochana Satpathy of Narayanpur Sasan village under Kabisuya Nagar police limits in Ganjam district were found dead after their 27-year-old teacher's son passed away in hospital in Bhubaneswar. The state government had announced a compensation of Rs 50 lakh for families of all frontline workers who die of the virus while deployed from COVID-19 duties, Tripathi claimed in his petition. Universities like the Aligarh Muslim University, Delhi University and Jamia Millia Islamic have seen the tragic intergenerational loss of promising young teachers and veteran academics, read petition. For government school teachers who have been deployed by states on several fronts to do crucial non-academic work, the pandemic brings more challenges, Tripathi said. And now moving on to the next news. India on Friday abstained from voting on the UN General Assembly resolution on Myanmar, saying that its views were not reflected in the draft resolution and a consultative and constructive approach involving Myanmar's neighboring countries is important as the international community strives for the peaceful resolution of the issue. UNGA had adopted a resolution in Myanmar calling upon the Myanmar armed forces to respect the people's will as freely expressed by results of the general election of November 8, 2020, to end the state of emergency, to respect all human rights of people of Myanmar, and to allow the sustained democratic transition of Myanmar, including the opening of democratically elected parliament, and by working towards bringing all national institutions, including the armed forces, under a fully inclusive civilian government that is representative of the people's will. Explaining the Indian context, India's permanent representative to the United Nations, T.S. Tirumuthi said India finds that its views had not been reflected in the draft being considered for adoption today. India would like to reiterate that a consultative and constructive approach involving the neighboring countries and the region remains important as the international community strives for the peaceful resolution of the issue, he said. The fact that there is lack of support from all neighboring countries as well as several countries in the region itself should hopefully serve as an eye-opener to those who chose to pursue a hasty course of action, the Indian envoy said. India is therefore constrained to abstain, added Trimuthi. India shares both land and maritime borders with Myanmar. India has direct stakes in the maintenance of peace and stability in Myanmar. In this regard, India welcomed the ASEAN initiative on Myanmar and the 5-point consensus. It calls for the envoys dispatched and the immediate cessation of violence. Tirumuthi stressed on diplomatic engagements aimed at the strengthening of these efforts and called for upholding the rule of law and release of detained leaders. He said that India's position on the situation in Myanmar has been clear and consistent. He has expressed deep concern on the developments in Myanmar and strongly condemned the use of violence and urged maximum restraint. U.S. top coronavirus advisor Dr. Anthony Fauci on Friday admitted that COVID-19 could be a lab-invented illness and acknowledged by scientists in February 2020. Fauci said that he was open to the coronavirus lab leak theory all along, saying acknowledged COVID-19 could possibly be an engineered virus, with the potential of an accidental leak from a lab, but maintains that the most likely origin was through zoonotic transmission, reported Fox News. Amid criticism of an inconclusive international probe into the virus origins and new reports of COVID-related illness in the region weeks before it was officially identified, the theory is once again sparking debate that the virus virus leak from Wuhan lab. Earlier this month, a report by Wall Street Journal had stated that 3 researchers from China's Wuhan Institute of Virology sought hospital care after they fell ill in November 2019, a month before Beijing reported the first patient with COVID-19-like symptoms. Fauci discussed the conference call that took place on February 1, 2020, just days after the World Health Organization raised the alert level on COVID-19, calling it a public health emergency of international concern, during an interview with USA Today this week. Fauci told USA Today that they decided on the call that the situation really needed to be looked into carefully. The call included several scientists, including Christian Anderson, an expert in infectious diseases at Scripps Research Translational Institute in California. In an email to Fauci the day before the call, and reviewed by Fox News, Anderson wrote that the unusual features of the virus make up a really small part of the genome, so one has to look really closely at all the consequences to see that some of the features potentially looked engineered. The Indian SARS-CoV-2 Consortium on Genomics, or INSA-CoG, a consortium of 4 city clusters, Bengaluru, Hyderabad, New Delhi and Pune, will soon release a report on Delta Plus variant, government sources informed on Friday.
In India, the Delta variant has further mutated to form the Delta Plus or AY.1 variant. Initial data suggest that Delta Plus variant shows signs of resistance towards monoclonal antibodies cocktail treatments. However, most experts and scientists believe the prevalence of this variant is still slow in India. The first case of the Delta Plus variant was reported in a 64-year-old woman from Bhopal, Madhya Pradesh, who recovered under home isolation. The INSA-CoG is keeping a close watch on this Delta Plus variant, monitoring, and they will be releasing a report soon. Dr. V.K. Paul, member health of the Niti Aayog, said that Delta variant is a variant of the investigation. We are still trying to understand its impact on transmissibility and severity of diseases.
The central government has clarified that the expert group constituted to provide technical inputs and recommendations on fixation of minimum wages and national floor wages to the center will submit its recommendation to the government as early as possible.
The tenure of expert group in 3 years, the ministry said it has come to notice that certain section of the press and some of the stakeholders have opined that this as an attempt to delay the fixation of minimum wages and national floor wages by the government. The government does not have any such intention and the expert group will submit its recommendations to the government as early as possible, the press release stated. The tenure of the expert group has been kept as 3 years so that even after the fixation of minimum wages and national floor wages, government may seek technical inputs or advices from the expert group on subjects related to minimum wages and national floor wages as and when required, it stated. The first meeting of this group was held on 14 June 2021 and second meeting is scheduled for 29 June 2021, read the release.
And now moving on to the next news. The cumulative number of COVID-19 vaccine doses administered under the nationwide vaccination drive has exceeded 27 crores, the Ministry of Health and Family Welfare informed on Friday.
On the 154th day of the COVID-19 vaccination drive, the center informed that 27,20,72,645 doses have been administered so far, as per a provisional report issued at 7 p.m. today. Out of these, 22,16,11,881 people have received their first dose, and 5,04,60,764 have taken their second jab. On Friday, as many as 29,84,172 vaccine doses were given. From these, 26,24,028 beneficiaries were vaccinated for the first dose, and 3,60,144 beneficiaries received the second dose of vaccine, as per the provisional report. In the age group 18 to 44 years, 19,43,765 vaccine doses were administered as first dose and 77,989 vaccine doses given as second dose on Friday. Cumulatively, 5,15,68,603 persons across 37 states UTs have received their first dose and 11,40,679 have received their second dose since the start of Phase 3 of the vaccination drive. Assam, Bihar, Chhattisgarh, Delhi, Gujarat, Haryana, Jharkhand, Karnataka, Kerala, Madhya Pradesh, Maharashtra, Rajasthan, Tamil Nadu, Telangana, Odisha, Uttar Pradesh and West Bengal have administered more than 10 lakh beneficiaries of the age group 18 to 44 years for the first dose of COVID vaccine.
Union Home Secretary Ajay Bhalla on Saturday wrote to the states and union territories and urged them to follow the calibrated process carefully while opening up activities amid declining COVID-19 cases. Mentioning the sudden rise of COVID-19 cases in the second wave of the pandemic and the COVID-induced restrictions that followed, Bhalla highlighted that imposing or erasing the restrictions should both be based on the situation's ground-level assessment. The Home Secretary has requested the states and union territories to ensure that the process of easing of restrictions is a fully calibrated one, which follows the five-fold strategy of COVID-appropriate behavior: test, track, treat, and vaccinate. He therefore urges the authorities to issue directions to districts and all other authorities concerned to keep a close watch on the situation while activities are opened in a cautious manner and to scrupulously ensure that there is no complacency in adhering to COVID-appropriate behavior and in a test, track, treat, vaccinate strategy, read the letter. He also asked the Chief Secretaries of the states and UTs to direct all concerned authorities to ensure that the COVID-19 testing rate does not drop and that a system to check surge at micro levels is set up. As the situation is dynamic, a close watch needs to keep on early signs of a surge in active cases or higher positivity rates, he added, pointing out at the need to vaccinating the nation against COVID-19 to prevent a second wave-like situation in the future. Bhalla directed all local governments to increase the pace of vaccination so as to cover a maximum number of people promptly. A special court on Friday dismissed the bail petitions of alleged middleman Christian Michael James, a British citizen, in both CBI and ED cases in connection with the Augusta wrestler case.
Advocates DB Singh and NK Mata, representing prop agencies, had opposed the bail petitions. Michael is being propped in two cases relating to the Augusta Westland deal, being propped by CBI and ED. In his bail plea filed through advocates Aljo K. Joseph, Sri Rampi and Vishnu Shankar, the accused has expressed willingness to cooperate with the investigation. The applicant, Michael James, will be available to join the investigation, any future investigation and trial, as and when required, and has never sought to evade the process of law, read the bail copy. The advocates told the court that Michael has made no attempt to suborn witnesses, tamper with documentary evidence, or in any other manner pollute or obstruct the judicial process, and further, the applicant undertakes that he shall not tamper with evidence or influence witnesses, nor is there any reasonable or justifiable apprehension thereof. Christian Michael, the alleged middleman in the deal, was deported from the UAE and is currently in judicial custody. A Dubai-based businessman, Rajiv Saxena, was also extradited to India on January 31, 2019 in connection with the Rs 3,600 crore alleged scam relating to the purchase of 12 VVIP helicopters from Augusta Westland.
This is all for DI Today. Keep watching Hornbilltv.